I want to tell you about a story of ICONS. ICONS stands for Improving Cardiovascular Outcomes in Nova Scotia. ICONS was a large demonstration project in which there were multiple teams, physician specialists, generalists, community family physicians, and community pharmacists and community nurses, experts in cardiology, the Heart and Stroke Foundation of Nova Scotia, people from the Ministry of Health of Nova Scotia. Their shared goal, this team of committed people, was to improve the care and the outcomes of patients with cardiovascular disease. And they studied three specific diseases: heart attack, unstable angina, and people with heart failures. The partnership used also, though, measurements of medical practices, prescription patterns, diagnosis patterns, and outcomes of these patient groups. What if we involved the patients and their families in the same process? What if we gave the patients who have the most vested interest in things getting better, prescription patterns and outcomes, if we involved them and their families in the communication process, the measurement, the feedback, would it have a positive impact that was above and beyond what we were seeing when just the providers were involved in the teams? This is a real newsletter. It came out about midway through the study. Patients and their families got the same version. A website was also concocted where the patients could look at these results as they were. So all of the same measurement and feedback of the clinical outcomes, both process and true outcomes, was being fed to all of the people in the partnership. It appears that knowledge translation to patients produces a very heightened, improved sense of satisfaction and well-being. Use of evidence-based therapy improved consistently. The rehospitalization rates decreased. The mortality of the population did not change. But there was a marked decrease in need for rehospitalization. It decreased about 20% on average. The communication in this very large team, which is made up of many smaller teams, was a keystone of intervention which was underrated at the beginning. There was a tremendous communication intervention which was not realized to be so tremendous before the results were seen. It was being taken for granted. As we discover what the keystone tools and competencies are for working in teams, it would be nice if the system side of the health universe was providing us with facile measurement tools. I don't think systematically we are doing all the things that we need to do to make sure that we're setting common goals, that they're achievable, and that we're making the measurements to know that they're achievable. We're not accounting it, and we're not feeding back those measurements which drive further improvement. So my guess is we probably have some lost opportunity at this time. Ministers of health, deputy ministers of health, heads of the regional health authorities, heads of the hospital, planners in the Department of Health, they're advocating very strongly that people work in teams. Do you have a goal? Can you clearly define the goal? Are you planning to use interventions that include measuring and feeding back patterns of practice and outcomes and some other communication of important knowledge for patients or relevant knowledge for patients? And do you have a data management system that will facilitate it all? The measurement and the communication of it is a very important component of having successful outcomes, all kinds, but particularly clinical, fiscal, and also making these team members feel better.